In this episode, I have the pleasure of speaking with Dr. Adeola Mead. Dr. Adeola has more than 15 years of clinical experience and has worked with countless individuals who want to perform at their peak in all aspects of their lives. To achieve this level of productivity, Dr. Mead helps clients identify the areas of their health that require the most attention. Together, they develop a data-based self-care strategy to meet those needs consistently. Welcome to the show, Adeola.
Thank you so much. Thanks for having me.
Thank you. Thank you. Again, one of the reasons why I wanted to have you on the show is because you have quite an impressive background. And I had a feeling that the audience would definitely benefit from having you on the show. So, why don't you tell us about yourself?
Thank you so much. So, I am a naturopathic physician. I've been practicing for over 15 years now. So, for those of us who aren't familiar with naturopathic medicine, it's really primary care with a focus on a whole person. So, not just what are these symptoms, more like who is it that has these symptoms. So, really getting to know our patients and understanding how the body functions in relation to the mind and to the spirit, and then using natural medicine to bring all of those into harmony.
Wow. Okay. So, what inspired you, or who inspired you to pursue mental and metabolic health?
You know, I think mostly my patients.
Okay. Okay.
After practicing for, I don't know, several years in areas where there's a lot of hustle, like the name of your podcast. So, practicing in Seattle, Washington, and in San Francisco Bay Area, in Vancouver, BC, in Canada, seeing lots of professionals who are just working hard and trying to achieve on all levels of life, and then seeing that their symptoms were really where there was a dovetail of both mental health concerns and metabolic health, because there is no separation between your mind and your body. But I
Yeah.
found that there was a separation in how those things were being treated. So I decided to
Hmm.
tailor my approach to include both of those things so that people could have the best results. And really, it was my patients who inspired me. The more we looked more holistically and brought those two pieces together in their treatment, the better they got. And I just love to see people thrive.
Fantastic. Fantastic. And y- I love how you have the combination of everything. Why do you feel that so many doctors separate the two? Because that makes, to me, what you just said makes complete perfect sense. But a lot of doctors don't, treat the person that way. Why is that?
Yeah, I think it's the training. When you go into conventional medical school training, you learn how different systems work, kind of independent of each other. And then you specialize often on one form of treatment. Maybe you're a radiologist, or maybe you're a family physician, or maybe you
Sure.
specialize in anesthesiology, but you hyper focus on this one modality of treatment. And you have a certain tool set, right? A toolkit.
Mhm.
But in naturopathic medicine, and very much in my background as an individual, in my family background and my
Sure.
cultural and ethnic roots, everything is always together. So it made sense to me to practice in a way where diagnosis is holistic, treatment is holistic, and then how people move forward in their treatment plans is also holistic. So bringing in community and natural medicine and sort of ways that are accessible to people to heal. So I think it's partly the training is hyper
Mhm.
focused on one thing and getting very good at one thing, which can be a lifesaver.
Sure.
I want a surgeon who knows that surgery
Yeah.
in and out if I need surgery, and not
Uh,
necessarily a generalist who's maybe in it
yeah.
once or twice. I want someone who's in it all day, every day for
Yeah.
you.
Yeah. Yeah.
So there is the benefit to that. But when you're talking about like chronic disease, which most of the diseases that most people are dealing with are chronic
Sure.
long-term diseases that cause long-term inflammation and long-term suffering, it's so much better to have a more holistic view.
Sure. No, I completely agree. Completely agree. You know, segueing into a little bit of a different topic, what are some common issues that affect women in the workplace? Again, everything you just spoke about is trying to make sure that we're the whole person, right? But sometimes in the workplace, depending upon where you work at, that could be detrimental to your health and not
Yes,
helping.
that's true. That's true. I think in the workplace, women are the way women always are. Like we tend towards caregiving roles. So we tend to bring that gift of femininity into the workplace too. So we're not
Yeah.
just doing our jobs, we're trying to do
Yep.
it the best way we possibly can. And then if someone else is struggling, we're trying to help them. If there is a committee that needs to be head, we're trying to take care of that. We're always just taking things on. And then we get home and we are taking care of maybe young children, we're taking care of elders, we're taking care of partners, we're always taking care. So I think one of the main issues that women face in the workplace is not having as much support as we need, because we
Yeah.
take on a lot, but we don't always have the support to just kind of dissipate the pressure that we feel a lot of times.
Mhm.
So that's one thing, is not getting the support we need to take on all the roles. Sometimes it's not being acknowledged for all the things that we're doing. That happens often enough, where people are doing the most in their workplace. They're exceeding expectations, but they're not being acknowledged, and maybe then they're being passed up for um, promotions and
Yeah.
for raises and things like that. And that
Yep.
adds an extra financial struggle, and also sort of emotionally, you're doing well, you're good at what you're doing, but that's not being reflected back to you. So there's a lot of stress that comes from
Yeah.
that. One, taking
Yep.
things on and then not being acknowledged and like fairly compensated for what you're taking on. And that stress doesn't just translate into, having a hard time doing your job. It Again, there's no separation between your mind and your body. So if you're feeling stressed and like you're not being fairly compensated and acknowledged, then that goes into the body as well. So now what
Mhm.
I tend to see in the office is lots of cardiovascular health disease, digestive concerns, reproductive health concerns, and fatigue, things like that, just to kind of start with. And people don't always know that those are connected, but they absolutely are.
Interesting. And so I want to piggyback off of that. What, from a workplace perspective, is the onus on, well, obviously we should be in control of our careers, but is there something that organizations can do to help their employees have a better kind of like work-life balance, or just to promote some of the things that you were discussing in order to make sure that, our employees are staying as healthy as they can?
Yeah, I think the first thing is just to acknowledge that people have lives outside of work. So
Right?
respecting their time outside of work, that would be a good place to start. Not sending
Yeah.
emails and expecting people to be on all the time, especially now, like post-pandemic, a lot of people have hybrid work,
Yeah.
or work mostly remotely. And employers sometimes expect people to be at their screens 8, 9 hours a day. That is too long to be at a screen. That's
Yeah.
going to affect your mental health. It's definitely going to affect your physical health. Like, we need to move. We are we're animated beings. We need to move. And if you're in front of a screen all day, that's going to affect your physical, your structure,
Yeah.
your metabolic health, your mental health. So, rem- being reminded that and acknowledging that people have lives outside of their work is a very good place to start.
Yeah.
And then figuring out where people need support outside of work too. So, for example, a lot of women are in a sandwich generation where they're caring for um, children and elders, and how can you support them in that so that they can bring their full selves to work? If what you care about is getting the job done, then you need to make sure that people can bring their full selves to work. Because if I'm thinking about my kids and my mom or my in-laws, then it's very hard for me to focus right now. And a lot of people are, especially women. So, and I read the study recently that was done in the Netherlands during the pandemic, and it was figuring out how to define and improve team resilience and how it was different from individual resilience. And to
Hmm.
improve team resilience, one of the major factors was to, one, improve familiarity, so making sure that people work well together. So that's one thing. If you want to improve work-life balance, is make sure that people on teams connect well. So make sure that you are thinking about a social aspect to being at work, whether you're hybrid or virtual or all in person. Create a culture where people can connect and get to know one another, to be respectful and work well with one another. And the other factor was family support. Not so much that, people have emotional support from family,
Sure.
but support that means that people have things taken care of at home, so that they can bring their full selves. So the first thing that came to mind was dependent care. right? And just all those other little things that people are always taking care of. How can employers invest in giving resources so that those things are better taken care of so people can bring their full selves? Because it is shown to help with team resilience in general. People work better together, better results, and they're more resilient when there are changes. And this is an ever changing, like dynamic workforce that we're in right now.
Sure, sure.
Yeah.
I love that. I love that. So, we're constantly, I want to make sure this question's a little long. So, we're constantly hearing stories about healthcare inequities, right? Among people of color, but especially among Black women. So, how do you believe that we can go about bridging this gap?
I think the most important thing is to know our worth in the marketplace, right?
Yes,
I
yes.
think a lot of times we will just kind of take what we can get. And I think then we get what is being offered if that's the situation. So I think a lot of Black women are highly educated, more
Oh,
educated
yeah.
relative to other demographic groups,
Yep.
right? So I
Hmm.
think we need to own that. We've gone through a lot of school, we've gotten very good at what we do. And even if a position or an employer doesn't see us that way, we need to make sure we present ourselves that way, right?
Sure.
And a lot of times people will see you the way you present yourself and make a case for what you're bringing, the value that you bring to an organization. So I think that's one
Hmm.
thing, is just really knowing your worth. And the next is asking for it, right? So just saying, here are
Yeah.
my credentials, here's what I know, and doing our homework. Here's what I know this position is earning, and is the earning potential of this position. Here's how I exceed the qualifications. So how do we make sure that this is a well compensated role so that you can get the best out of me based on my expertise, and this is fair, and I'm happy here because I know that I'm being well compensated. And I think just being very matter of fact about that is, I know what I'm worth, and so I'm going to ask for my worth, and here's the proof of what I'm worth. Not so much just kind of going in and demanding,
Yeah.
because that doesn't work in any
Of
scenario.
course. You got to have the results to back it up.
We have
Of
to have
course.
the receipts, and Black women have the receipts. So just
Oh,
bring
yeah.
your receipts in and saying, here's what I'm bringing, here's the compensation is expected of this role. So how do we find a middle ground that works really well, that reflects our worth? And then the other thing is to support one another. I think Black women are incredible at creating cultures and bringing people up along with us, but I think to
Yeah.
really be intentional in supporting other young Black women coming up in spaces and making sure that there isn't any competition or making people feel like they need to pay their dues. The more each one of us gets ahead, the more as a collective, as women, as Black women, as professionals, we all get ahead. So just maintaining that, already kind of ingrained culture within Black women to bring others along with us, I think is a great place to start. And to make allies too, right? Like, we can't do everything on our own. I think it's important to be strategic in the people that we associate with, and especially in networking. I think it's important to network and for people to know you not just as a professional, but as a person, and to be able to vouch for you too, because a lot of times we are getting roles um, and being presented with opportunities because someone else spoke our name in a room that we weren't in, right? So how do we continue to network and build our networks to be what they say, like your net worth, right? So making sure
Yeah.
that you're associating people that are where you want to be or can help you get to where you want to be.
I love that. Love that. Love that. And again, kind of piggybacking off of the whole corporate world aspect, a lot of women, especially Black women, suffer in silence, with PMS and PCOS. What signs should we be on the lookout for, and what are ways to alleviate these symptoms? Because again, so many of us wear like that superwoman cape, right? And so a lot of us are suffering in silence with especially these particular things that I just named. So just curious what your thoughts are regarding that.
Yeah. Thank you. So those are very specific women's health issues, and I think it's important to be really well educated. What is PMS? What is PCOS? Are we making sure that we are working with a doctor who can keep an eye on hormone levels? Because these are both hormone imbalances, right?
Mhm.
And to not, this could be a very long answer, but um, hormone imbalances often come from or are worsened by stress. So we have to look at how much stress
Mhm.
that we're having too, right? And that's not just like psychological stress from our environment, but also like a physical stress. So a lot of times if people are eating, for example, inflammatory foods, then that's going to cause more inflammation in the body, shift hormone production, and make it so that we're more likely to have some of these symptoms that are related to PMS or PCOS. I've had lots of patients who are having, so for PMS, some of the signs and symptoms are cramping, heavy periods, irregular periods. Lots like very, very heavy flow, lots of pain, lots of fatigue, lots and lots of fatigue, and mood swings as well, or digestive changes too. So that could be happening every single month. And that is definitely going to take your focus off of your work and your life and draw it inward to how you're going to manage these symptoms. With
Sure.
PCOS, that is it's a different hormone imbalance, but that is related to insulin resistance.
Hmm.
So, a difficulty in managing blood sugar over time. And then also with high, like, sort of typically male hormones. So, again, this is like
Mhm.
hormone imbalance. So, high androgens, for example, which can cause hirsutism or just lots of facial hair or body hair. So, that's another thing to
Mhm.
watch out for, and irregular periods too with PCOS, or difficulty with fertility as well. So if you're trying to conceive and having a difficult time and have some of these other symptoms too, that would be a good time to get testing done and look at hormone levels for PCOS. But a lot of those symptoms are alleviated by nutrition and lifestyle. So making sure we're
Wow.
managing stress, making
Mhm.
sure that we are eating an anti-inflammatory diet. So avoiding foods that commonly cause inflammation. And they're like typically like seven of them that are common. So it's like sugar, gluten and wheat, dairy, soy, corn,
Hmm.
yeast. Um, there might be one more. Eggs. Those are the typical
Oh,
ones.
wow.
Mhm.
Okay, soy
And
is interesting because a lot of people, I mean, soy milk, I mean, a lot of people use all of these different alternatives, soy for a lot of things. So soy is not necessarily good for you?
not always, and it really depends on the person, right?
Okay. Okay.
So for some people, and I've seen fairly typically, it's eggs, and eggs are healthy food, right? But there are a lot of
Wow.
people who, I had one patient years ago who had kind of lifelong dark circles under her eyes and terrible digestive issues. And she had just dealt with it for years and years. She came in and saw me, and we actually did food sensitivity testing, which is a great way to go if you're just not sure. You're eating healthy foods, but you're not sure what's causing your symptoms of like chronic inflammation. So we did
Hmm.
testing, and the highest in sensitivity that she had was to eggs. So we just simply took eggs out of her diet for, it was like 3 weeks, and the dark circles that she had since she was a little girl went away for the first time in her whole life. It was eggs, this consistent
That's
exposure to eggs.
insane.
Yes, her digestion got better.
Oh
I've had
my
people who
goodness.
had like really, really severe skin lesions. Like, I mean, it's hard to describe. It's not acne, just like sores, open sores all over their faces and all over their arms. This one patient I'm thinking about had it for years, didn't growing up necessarily, and it just got progressively worse. And they were trying to use all
Mm.
sorts of topical applications, and it just wasn't working. And we did, again, to figure out what is going in your body that's causing inflammation on your skin. So, of course, we can look at how's your body processing um, food and so on and so forth. But if
Wow.
you're always putting things in your body that are causing inflammation, then you're not going to make a lot of headway. So we figured this out, and we figured out the list of foods that are causing issues for her. And within, I think it was like 2 or 3 months. So this had been years of sores on her
Mm.
face. Within like 2 or 3 months of eating her specific anti-inflammatory diet, her skin was like a baby skin. It was the most remarkable thing. Like, it was completely cleared up, completely smooth. And we just have to remember that we're not these like separate entities. The skin isn't here and the digestion over here and your mental health over here. Everything is together. So first thing is just to minimize or avoid things that are going to cause problems and then deal with what's left. So a lot of times, like with some of the hormonal balances you're talking about too, it's first, what can we avoid that is causing problems? And a great place to start is food to reduce inflammation.
That is absolutely fascinating to me. So is that something, if I'm not mistaken, I believe you're based in Washington, right? Is that something that you, um, can you diagnose like via virtually, or like how do your services work? Just curious, because that's amazing.
Yeah. So I can typically meet with someone and kind of understand for a consult and understand where they are. I usually, if I'm not working with someone in Washington State, will refer them to either a doctor in their state they can work closely with. If it's
Sure.
something as simple as maybe ordering just the food sensitivity testing for them to see what would be a good anti-inflammatory diet for them, then I could start them off that way and order, but then connect them with someone they can work with more closely. But it really just starts with a consult and understanding who they are, what they're dealing with to figure out what our next step would be.
Okay, had to ask that because I know that a lot of folks are gonna be like, "What? That sounds magical." Like, so
Yeah,
I'm
yeah,
just asking the most obvious question that I know other folks would wanna know, so
yeah. You would be surprised the things that clear up when we're very intentional and listen to our bodies about what we consume.
that
And
is
that's food wise, but also environmentally, emotionally, spiritually. What are we taking in and how is it affecting us? When we start to pay attention to that, the results can be transformational.
absolutely amazing, amazing, and here's another issue that, uh, affects women in general, but once again, primarily affects Black women, and that's fibroids, right? So, oftentimes, and I've been reading, I'm kind of a healthcare nut, it's not my background in any way, shape, or form, but I love reading those types of studies, but oftentimes surgery is the alternative suggested to remove the fibroids.
Mhm.
However, are there any alternatives, like, from a natural perspective to address the issue?
Yeah. So it depends on the type of fibroid, the size of the fibroid. So if
Mm,
a woman is diagnosed with a small fibroid that is not causing problems with the rest of the reproductive tract, then some of the things we talked about with balancing hormones
wow.
can make a huge difference to shrink the size of the fibroid because they are hormone sensitive. I'll tell
Mhm.
you a personal story. I didn't know I had fibroids. And then when I was pregnant with my oldest, because of this surge in hormones, I had a fibroid that grew through the pregnancy. Now, I had it,
Okay.
my body does not play, apparently. So I had a lot of hormones, and this fibroid grew to, I think it was 5 pounds and the size of a volleyball. Okay, it was huge. So, and it was
Wow.
sitting on top of my baby during this pregnancy. So I had like a baby, a bump, right? And then I had another bump on top of my bump. I was huge.
Oh,
I was
okay.
huge. So I have my baby, and he's totally fine because the fibroid is on the outside of my uterus, right? So they can be on
Mm,
the outside of the
okay.
uterus, they can be on a little stalk, it can be inside the muscle of the uterus. So again, it really kind of depends on
Where?
what type and where and what size. So if it probably started as just like a small thing because I never noticed it. So if I
Yeah.
hadn't noticed it through this pregnancy, then probably you could go in and just snip it off this little stalk and just cut it and you'd be totally fine. But because of the size of it, it had to be operated on, right?
Mm,
And but while I was waiting for the surgery, I was able to shift my nutrition and shift my hormones to reduce um, the exposure of the fibroid to hormones so that it could shrink some while I was
sure.
waiting for surgery. So that's an important thing to remember is that there are ways to shift the exposure of the fibroid to hormones and shrink them sometimes, not
Okay.
always the case.
Okay.
If they're not bothering a woman, they're not huge, they're not causing heavy periods or something like that, then that's a great way to go. If they are causing trouble with reproductive health or difficulty with fertility and conception, then surgery is often the best way to go because if it's not shrinking and it's in a position that is detrimental for the plans of the woman, then yes, surgery is the good way to go. But prevention really is the best cure when it comes to those. And a lot of Black women are exposed almost our entire lives to endocrine disrupting products, be it skin products or hair products too. So there hasn't been like
Mm.
any I don't think definitive study that like hair relaxers, for example, disrupt hormones, but it has been a consideration over time. So, and there are lots of
There's lawsuits against that right now.
there
A
are
lot of
yeah,
companies that are so I there's got to be something there, right? Like,
there's definitely something there, and also
mhm,
just like a lot of Black women aren't necessarily growing up with the best environments for the healthiest nutrition, right? So we have a
gotcha.
lot of us who grew up like in food deserts where there just there are not enough resources for healthy, balanced nutrition. So you're going to be skewed towards
Mm,
a more inflammatory type of nutrition that shifts hormones and makes it so that we're more likely to have these like hormone sensitive type growths that like a fibroid. So there's so many like multifactorial reasons why Black women in particular can experience more fibroids, but prevention when it comes to helping to reduce inflammation, reducing stress, um, working with nutrition and lifestyle can go a long ways. But beyond that, if you're dealing with a size and a type of fibroid that is causing a problem, then yeah, surgery is the standard of care.
okay. I want to piggyback off of that again. So, in the event that a woman is kind of like pushed towards the surgery
Mhm.
route, is there, I guess, is there a chance that the fibroid could grow back, or like what happens from that point?
Yeah, the best thing at that point too is kind of start from zero and start to minimize inflammation and minimize excessive um, exposure to hormones. And the other thing too, that a lot of
Mm,
us are on like hormonal birth control, right?
mm,
And this is exogenous, so not hormones that our body is producing, but hormones that are coming from a pill or from an
yeah.
implant or whatnot. And now our bodies are having this exposure to hormones that are not coming from our body, and that can definitely make it so that we are more likely to have these like hormone imbalances and hormone kind of sensitive issues. So that's another thing too, is like, so if someone has a fibroid removed but they still have high levels of exogenous hormonal exposure, then it's possible not necessarily that one would grow back, but maybe other ones would grow back because you're
Similar.
still having this high exposure to hormones. So that's something to keep in mind too, is what are ways that as a culture and as Black women, we can move away from hormone disrupting exposures, right?
Sure.
Topical, hair, skin, all that environmental, but then also what we consume and what we take as medicine. Like, can we move away from these external forms of hormones that are impacting our bodies?
Yeah, yeah. No, that's really great information because it's something that I've been hearing more and more about, like fibroids, and I always wonder why is it just one particular demographic that seems to suffer from certain things more so than others. So that's a really good point. Thank you for that. So,
Yeah,
yeah.
sure. I mean, there are kind of race specific to a certain extent conditions like Black people, whether they're in the United States or in the Caribbean or in Africa,
Mhm.
are more likely to have cardiovascular health conditions, right? So that there might just be like a genetic propensity there, but there are lots of things that we can do when we look holistically to minimize some of those genetic inclinations. And it might just be that Black women too, like we tend to have more muscular bodies, and the uterus is just a big muscle. So we might just tend genetically to have more hypertrophy, you call it, or just like greater like proliferation or growth of muscular cells, and that might just be part of
Mhm.
why we tend to have more fibroids as well. So it could be lots of different reasons, but those are some that we can have some control over, is
Yeah.
minimizing like inflammation overall.
No, I love that. And I know you mentioned something about genetics. And so I do I understand your comment, but I also want to challenge like the medical community not to be lazy and just rely on, oh, it's just genetics. Because a lot of times, a lot of people just want to say, oh, maybe it's just a propensity with that particular demographic and then do nothing with it. Like, no, we need to dig a little bit deeper.
Yes, and that is absolutely dangerous
Yeah.
is the problem. And a
Yeah.
lot of people end up having very poor a poor standard of care because of that assumption
Yep.
on the count of a medical professional, and it's really sad and it's dangerous and it's quite rampant. I think it's important in the back of our minds to understand that there are differences in demographics that might be
Yep.
genetic, that might be generational and environmental, but we need to focus on the person in front of us, right?
Exactly.
So
Yep.
um, that's that is the responsibility of every healthcare practitioner. Like,
Yeah.
yes, this might be related to what I've read and what is in the research, but what's going on with you? And let's make sure we do a full workup. That is a responsibility of a provider.
I love that. And the only reason it got me thinking about that is because I can't remember which company this is. It could be Advil or I don't know who it is, but they literally have purchased different end caps that say that are acknowledging the fact that like Black people experience pain the way other people experience pain. Does that make sense? Like
Yeah.
they actually purchased an end cap. They were in certain stores where it says, you know, I'm in pain, like as to reaffirm the fact that we believe people when they say that they're in pain. And I'm like, on one hand, kudos for acknowledging that that is an issue, but on the other hand, like
Really? We have
like,
to
do we
declare.
really need yeah, do we have to clarify that? But I've read in certain cases, like, a lot of physicians
Mhm.
don't, they just have this assumption that Black people have a higher pain tolerance, and I'm like, "Last time I checked, the skin's the same, man, it's just a different color melanin." I just
Yeah, that is like some ingrained systemic racism, and it's detrimental on every level, and
yeah,
it's detrimental to provider too, because now you're not even equipped with the information that you need to care for
yeah.
your patients well. So
Mhm.
you're giving a poor standard of care. But in like maternal health, that happens. So a woman goes in and she's having contractions, and if she's a Black woman, she might not be believed. Oh, it's not that bad, or we're going to wait on to give them an epidural or to
Yeah,
address this pain. And then a lot of women just like suffer needlessly because of this like ridiculous assumption. And it's good that it's coming to light, but it
yeah,
should never have ever been that way.
yeah,
It
exactly.
doesn't make sense. Like you're saying, like
Like, I just
why?
when you were talking, I was just like, "Oh, this is so." That ad just popped into my head because I
Yeah,
saw that on LinkedIn. I'm just like, "Oof, okay." Anyway.
that's wild.
Oh my goodness. But, you know, again, as women, we all have different issues that we go through, and as we grow older, every woman is going to undergo menopause, right? So, how can women help prevent or reduce the effects of what, I jokingly refer to as my mom is having a private summer? How can we, reduce or prevent those effects of that?
So the first thing is to one, make sure that leading into the perimenopausal time
Mhm,
that you're having like I don't want to say standard, but predictable cycles, right? So
mhm,
if we're having lots of PMS, moving into perimenopause, so that means we're
mhm,
having
mhm,
an imbalance, even moving into this time where the hormones are going to shift naturally. So
mhm.
that's the first thing, is to make sure we're dealing with PMS before it turns into a really unbearable perimenopause and menopause, right?
Mm, okay,
So that's the first
okay.
thing. So, like I said, reducing inflammation, managing stress as much as possible. And there are lots of different ways to do that. So, that's one. Two, speaking of stress, what I find is that women who going into perimenopause and menopause have high levels of stress have more difficult menopausal symptoms. And I
Mm,
think part of that is because when we are premenopausal, our ovaries produce our estrogen and progesterone that help us manage our cycles, right?
mhm, mhm.
When we are under quite a bit of stress, our bodies will shift hormone production to produce less progesterone, for example, and more cortisol to help us manage stress, because we are meant to survive. We're built to survive. So the body is just like, forget about reproductive function. Let's shunt all the energy into managing stress because this is a struggle. Okay. So it's doing that just to help us manage. But that means you have where progesterone should be balancing estrogen on a monthly level, you're getting less of that because you're using the same resource that you use to make progesterone to make cortisol. So you're stealing from your resource to make progesterone to make cortisol. But now that means your estrogen is way higher relatively to your progesterone. You should be making way more progesterone than you are, but now it's relatively way higher. And that is where you have terrible PMS symptoms and lots of inflammation difficulty with that. So you're already experiencing that and you're producing more cortisol to help you manage this stress. Okay, this is all happening into perimenopause and menopause. Once your ovaries stop producing, estrogen and progesterone at what was premenopausal levels, what's supposed to naturally happen is that your adrenal glands that produce cortisol are supposed to start producing little bits of estrogen, little bits of progesterone to help you manage. But they're so exhausted from producing all this cortisol for so long that they're not able to help you balance very well. So what I do find is, one, managing stress, moving into that perimenopausal stage helps a ton. What I usually recommend is for women to, yes, do all the things with your calendar and with your to help you minimize keeping too many things on your plate, for sure. Implement healthy boundaries, absolutely. Figure out what sorts of mental, emotional, spiritual practices help you stay positive as much as possible. But I often recommend too a class of herbs and nutrients that are called adaptogens. And what they do is help your body adapt. So it helps minimize cortisol that's too high. It helps raise cortisol if it's too low too. So there are people who have just been producing so much cortisol, helping them manage stress, that they are not able to produce it at high enough levels anymore. And now they're exhausted all the time. It's just very hard to cope. And it can feel like exhaustion, fatigue, depression, that sort of thing. So adaptogens help your body get to a place where it can adapt. Do you need less of this or more of the other thing? And they work non-specifically. So it's not going to work just on adrenal glands or just on your nervous system or just on your reproductive glands or reproductive system. They work everywhere where your body needs the support. So they're different kinds of them, and everyone, I think, could use a different combination or one based on what their specific need is. But I would recommend looking into adaptogenic herbs and foods, and ones that help to improve the immune system as well, because when you boost immune function, you reduce inflammation. So those are some of the things that I start to tell women as they're getting to perimenopause, is looking at how your body is managing hormones now will help usher you into an easier transition. And then also remember that our liver is the organ that it's like your body's trash can. So it helps you
Oh, wow. Okay.
process everything. So whatever food you eat is processed, and then before the nutrients can go into your bloodstream and throughout the body, it goes through the liver. All of your hormones are processed in the liver too. So your thyroid, that focuses on managing your metabolism, your thyroid hormone is converted from inactive form to the active form in the liver. Cortisol processed in the liver, blood sugar, or your blood sugar stores are stored in the liver. All your food is processed there. Cholesterol also processed in the liver. So that's another focus where I make sure that we're making sure that your liver health is the best it can possibly be, because it works really, really hard. It processes every intake. If you have like a toxic exposure, for example, the liver has to process and detoxify that too. So, and it's a big player in digestion as well. So focusing on improving the liver health through, yes, supplements are helpful, but food as well. And even some topical applications can be helpful too. So those are the kind of things that we usually will look at, like how can we better balance these hormones, both with things that you can do, but also helping your body internally to find a better balance.
Super interesting. And you mentioned a term that I've never heard before, adaptogens. Is there like what what exactly is that? Is that like an herb, like I don't know, like thyme or garlic, or what is that?
Yeah, adaptogens are classes of herbs, sometimes foods that help your body kind of non-specifically adapt to stresses. So they can improve immune function, they can help to modulate how your body uses hormones, especially like cortisol. They can help with your nervous system. So we have two modes of our nervous system. There is your rest and digest mode, and then there's your fight, flight, or freeze mode, right? So a lot
Okay.
of us, when we're under stress, we're always in this fight or
Yeah, I
fight.
feel like I'm in that area a lot.
We're over here. And that's where you're going to have, so think about when you are fighting or flighting or fleeing, right? All
Yeah.
the blood is going to rush from your core to your extremities so you can run, right?
Yeah.
You're not going to digest very well, right? So then that's where a lot of people have digestive concerns because their blood is always
That's
out
what I
here
think.
and
Mm.
never going to their gut so they can like fully digest their food. It's very hard if you're
Okay.
stressed and you're fighting or fleeing. You're not going to sleep very well, are you? It's like this is not a good time to sleep. We're
Yeah.
fighting for our lives here, so you can start having more insomnia. If you don't sleep well, your immune system doesn't have a chance to kind of reset itself. So your immune function is going to be low. And that means you're going to have more inflammation in the body. So all these things are interrelated. So adaptogens can also help bring your nervous system out of this fight or flight mode into a rest and digest mode. So now your nervous system is making it so you're telling your body, we're good, we're good, we're not under attack. You
Yay.
produce the hormones at the right levels, you can digest your food, you can rest. So those are some of the things, and they're fascinating. They can help improve energy. Some of them are nootropic, so they help with your cognitive function. They can help with memory, and that's a big thing with women in menopause. It's just like I just can't remember that word I was going to use, or
Yeah.
a brain fog, things like that. So some of those have so many different functions that they can help on many different levels, the adaptogens. So I would highly recommend people look into them, talk to your doctor about whether or not
Yeah.
there would be one or combination or a product that would be a good fit for you. Definitely reach out if you have questions about it because they can do incredible transformative work in bodies.
Oh my goodness. I need to borrow a couple of those little guys. They sound amazing.
Yeah, they are amazing.
They sound amazing.
They are amazing. They do a great job. And again, but they're not, it's not like a substitute for
Sure,
the
sure,
things
sure,
we
sure.
have, control over. And
Yeah.
that's where we end up getting ourselves into trouble. So that's where we need to get ourselves out of trouble too.
Yeah. No, but perfect, perfect. And you know, this is a perfect segue to the next question because as someone who has suffered from digestive issues many, many years, I quickly realized like how much my diet can affect my mood. And again, I came across your information. So can you tell us a little bit more about your 40-day fresh start program?
Yeah. So, where a lot of times, well, all the times, your mental and metabolic health dovetails is in the gut. So, we have trillions of microbiota microorganisms that live in our gut that impact not just our digestion, but our mental health, our immune health, reproductive health, so on and so forth.
Mm.
So, making sure that your gut health is a priority really means that you are looking at improving the function of every other type of health that kind of
Mm,
focuses on the
sure,
gut too.
sure.
So my 40-day Fresh Start program was kind of born out of my typical treatment plan for patients who were having this um, constellation of symptoms that where mental metabolic health kind of dovetailed, right? So it's like
Sure.
anxiety and depression, maybe lots of bloating and gas or diarrhea or constipation or just like abdominal pain, and lots of stress that is underlying all these things. Maybe frequent illnesses, maybe autoimmune disease, maybe reproductive issues, or even just skin issues too.
Mm,
So what we would do then is just start with nutrition and lifestyle. We might do the focus, like anti-inflammatory nutrition based on testing, so food sensitivity testing. But then there's that, and we look at labs too, right? So let's just look at your lab work. How's your blood sugar? How is your vitamin D, which is a big part of your immune system and your mood? How are your hormones balanced? What else do we look at? We look at thyroid health. We look at red blood cells, white blood cells. So we do a good screen to see metabolically where are you and how's that reflected in your blood. Then we figure out the nutrition piece, and we start, if you need, for example, adaptogens or other types of treatments that are natural and easy accessible, it could be food as medicine, then we just start on a treatment plan that works for your body, specifically where you are. But again, a lot of this that gets you out of the woods of this state of chronic disease is lifestyle. So I have like a 6-week course where you will consume some content that I put together that was really just like my patient education over the years. And then we meet once a week because accountability is king or queen.
Yeah.
We're just going to tell ourselves, I'm going to start this program. I'm going to start it. And then it's like, oh, something happens today or tomorrow. I didn't get around to it.
Yeah.
We're human, these things happen. But if you know that you're meeting once a week with a group or with a provider, then it's more likely you stay on track. And I want people to receive the results, and I know they can. So either they join a group for accountability that myself or someone on my team will moderate, or they meet with me one-to-one, and then we make sure that they're moving forward on things like using food as medicine and getting the education they need so they can really create a life where their healthy body can thrive. So that's my 40-day Fresh Start program. And I just found that just within 40 days, people were having transformational results. So people were, how do I even start with some of them? So changes in skin, definitely like resetting their digestion. People with lifelong digestive issues were seeing relief within like 2 or 3 weeks, right? So people with cardiovascular concerns. I had one patient who had high blood pressure. Like after having her first baby, she had high blood pressure. So she was put on medication. The medication didn't quite agree with her. She stopped taking it, but her blood pressure was consistently high. And within 1 week of treatment, her blood pressure was normal and it stayed normal. And this was after like a year postpartum of consistent high blood pressure, trying things and it didn't work. So I just find that when you find the right combination of like holistic tools, you can get significant results very quickly, especially if you're doing the work to, again, create a life where you can actually thrive. So a lot of that is habits, and that's what that course is how do we change habits so that all the clinical work we're doing can really shine at the end of the 6 weeks, and you have now a life where you have healthy habits and your body is ready to go.
That sounds amazing. That really sounds amazing. And like I said, I took a look at it. I was just like, this sounds very interesting. Again, I I I wanted to have you on the show. I knew this would be very informative for the audience. So
Thank you.
and again, the program sounds amazing, but I'm curious, what are some of the most rewarding results you have seen in your patients? You've named so many, but is there one particular patient's results that you're like, oh my goodness, like this shocked even me?
There's so many. For example, the patient who had that high blood pressure postpartum in our course. So we're meeting once a week, and one of the things we talked about was just healthy boundaries, right?
Yeah.
And so there's this week the theme is healthy boundaries. So we talked about for her, what does that look like? So she had a very stressful, consuming job. So we talked about closing her computer at a certain time at night, putting it away, focusing on her family. So she said there was one day where she had done that. She had put her computer away. She was actually going to do, which can be very hard if you're a very driven person, you're used to working all the time. So she did it. And she said her 1-year-old at the time like fell asleep on her. And she said she realized that it had been months since he had done that. And she just was able to hold her baby. And she said she started crying, because she had missed
Oh,
that and all that time. And I started crying too. Okay. So I'm just like,
yeah.
it's so beautiful because it's not just that your body's feeling better, but this like reprioritization of what really matters and
Yeah.
noticing what really matters. Because when we're in it, all that matters is this one discrete goal. I want to succeed. I want to move forward in the corporate ladder. I want to earn and help take care of my family. And it's this very like myopic, blinders on goal. And we forget
Yeah.
that you're doing it for a reason, and you want to do it sustainably because of those important reasons. So that always just comes to mind as like a beautiful result of someone changing. I had another patient who went through the program and had incredible amounts of stress, family stress, work stress, and had been diagnosed with a chronic pain syndrome, which I think her mother had been diagnosed with as well. But she was a fitness instructor. And then all this culmination of stresses in her life and pain, the diagnosis of pain in her body meant that she was no longer able to train people in fitness anymore. And then she was almost unable to walk. Like, it was hard for her to get up most days. She
Oh,
was using
wow.
a cane, which was she like gained a lot of weight because she wasn't as mobile, and this affected her whole
Yeah.
metabolic health and definitely her mental health as well.
Yeah.
So it was this big shift for her. And so she went through the program and she started implementing some of the key, habits. And then we did the clinical work as well. And I'm so proud to say that she stuck with it, and now she's back to training fitness. She is a lead fitness trainer in the clinic or the space that she works in. So she's been able to like surpass what she was able to do before. And now she's dancing with her husband. And they had like canceled all their plans for the big, they were gonna have you know, hike and do all these like huge things because they had their kids young. So like, oh, we'll still be pretty young and inspired by the time these guys leave home. We're gonna travel, we're gonna do it. And they just like cancel all those things because she could hardly move for years.
Wow.
But then going through the program, now they're going out dancing again. So it's just like this, it's not just the physical health, it's the life. When I'm seeing people
Yeah.
live lives that are thriving, there's just nothing more rewarding for me.
That is absolutely amazing. I love hearing stories like that. And again, thank you for taking the time to actually look at medicine from a different perspective, right? Because a lot of people don't necessarily take the time to do that. Sadly, that's why a lot of people are needlessly suffering, right? So,
Yeah.
yeah, thank you for that. That's amazing.
Yeah, I'm
Yeah.
grateful for just like for the training, and for all the shoulders that I stand on, people that showed that looking holistically, thinking about community, and looking at both mind, body, and spirit are
Yeah.
the way to the most abundant health. So I'm just grateful for everyone that's poured into me and for everyone that I'm able to pour into now.
Fantastic, fantastic. Well, we are literally today is day 100 out of the 365. I don't know about you, but I feel like I remember saying Happy New Year, right? Like today is literally day 100. So
Wow.
I don't know. That was mind boggling to me. I looked that up. That's crazy. But if you had to choose one word to represent your goals for this year, what would it be and why?
I usually do have a word of the year. And towards the end of last year, the word that kept coming up for me was light. So I started
Ooh.
kind of to meditate on that. Like, I had a lot going on the past few years, and I felt like I just needed a lighter heart, a lighter load, to be very intentional about what I was choosing. And that has so far just been really lovely. There's been lots of lighthearted things that have happened. I've gotten to see like my family and spend time with my little ones more, and my workflow has felt more light as well, I think. So I think that's the main thing is, one, to keep sort of this levity and sense of um, I don't know about ease necessarily, but just like accessibility. Like, I can do this. This is
Yeah.
my wheelhouse. I'm taking good care of myself as I, do what I need to do. But then also like light as far as like illumination. So like I'm trying to learn as much as I can. And I'm a person of faith, so I'm trying to just let God's light shine through me as well. So, you have to.
I think we can see that. We can see that.
So just, letting my light shine, letting what I feel like is coming through me shine through, so that everyone can be blessed and benefit from, what is coming through and what's available really to all of us.
I love that. I love that. Light. That's a good one. I do like that. I love that.
Yeah.
So I have thoroughly enjoyed our conversation. But as with all things in life, good things have to come to an end. But last but not least, what's the best piece of advice that you have for women who would love to pursue a metabolic medicine career?
Oh, yeah. So I am trained in naturopathic medicine. So I went to naturopathic medical school here in Washington State. And I would say first is to learn as much about it as you possibly can. So interview current practicing doctors and get a mentor that you trust, someone who's doing the kind of things that you think you might like to do. Things change over time. You might want to
Yes.
specialize in something different. You might decide there's one aspect of this type of medicine that you'd like to focus on. But I would say just get as much information as possible. And also, it's not easy, right? It's not
Oh,
necessarily
sure.
like an
Of
easy
course. Yeah.
road. You have lots of education to get through, and then just to figure out how you want to use these tools. So I would always recommend that people connect with their sense of calling, right? Am I just doing this because it's kind of interesting, or do I feel like this deep calling? Because that's what keeps you going when it feels hard and when it
Yeah.
feels like there are challenges that you were not expecting. Is that sense of, this is absolutely where I need to be. This is where I know I'm called to be, that my skills would be best
Yeah.
used. And that brings you back that sense of motivation to keep going. So that would be my other recommendation, is make sure you feel called to it, get lots of information, and just go.
Love that. Love that. I have thoroughly enjoyed our conversation, and I know our audience has as well. In the event that they would like to connect with you, how can they go about doing so?
The best way is just via email and through my website. So my email address is info@dradeolamead.com, and my website is www.dradeolamead.com. So if you Google me, you'll find me.
Fantastic. Fantastic. Well, Adeola, I thoroughly enjoyed our conversation. I know the audience did as well. Thank you so much for coming on to the show.
Thank you so much for having me.
Thanks so much for listening to this episode. If you enjoy listening to Hustle and Faith and would like to support the show, please consider sharing it with your friends, rate or leave a review, donate, or make a purchase at our shop, Starring You Crew. Remember, if you're everything to everyone, then risk being no one. You never know who you will inspire. See you in the next episode.